Hello everyone. We all know that hearing problem is a very common problem, and we often feel that we are unable to have conversations with our own friends and family. It becomes a very difficult task for a person to do his daily activities without proper hearing, and we often don't understand what is the real cause for it. And there is a whole analogy to it. I think we need to take that kind of directions from an expert. So to discuss such minimal detailing which will make our lives better, here we have Dr. B. Naveen sir, ENT specialist who is working with DECC, which is DEENADAYAL ENT Care Center, to know more about these small intricacies that we often ignore in day-to-day life. So let us discuss with him and get more knowledge about the same. Hello sir, it's pleasure meeting you. And today we are going to discuss in detail about hearing loss or deafness. Can you please explain us what is deafness?
Deafness is defined as inability to perceive sounds, or in general term we call it as hearing impairment. Like to explain it, if you take a television, the television as a screen, so we see the picture on the screen. So the picture on the screen you get when it receives the relay.
Yes.
Right?
Yes.
So the output of television depends on the reception from outside.
True.
So what we speak is due to what we hear.
Yes.
So hearing is the most important aspect of an individual.
Yes. True.
Suppose you are talking to me, meaning what? You heard something and you are talking.
Yes. Response.
Meaning response.
Yeah.
So you have processed your ability to speak after listening to something.
Yeah. Huh?
So what did I speak?
I don't know.
I didn't speak anything.
Oh my God, that was all of a sudden.
Okay. So I didn't speak anything.
Yeah.
So this is lip.
Yeah.
What I said, how are you, what's your name?
Yeah.
But there is no sound.
True.
No sound, meaning I am not able to speak.
True.
I understand something by hearing.
True.
Then I
respond
in terms of speaking.
True.
The speech depends on the hearing.
So you mean to say?
I mean to say, if there is no relay, there is relay, but there is no reception.
Okay.
So there is damage or impairment of an organ in our body which cannot receive the sounds from outside. That means hearing is impaired. The individual is deaf.
Deaf.
Meaning the reception is not there.
There.
So is it easy to understand?
Yes, it is easy to understand. So I understand that until now I always felt hearing loss is about just the age. But in detail now when I'm just hearing you out with this one line, I feel it is a lifelong handicapness.
Yes.
Out of which we will be able to communicate properly, will be disabled for lifetime.
Exactly. An individual is there.
True.
You are seeing that individual is sitting. I am sitting.
Yeah.
You are talking to me.
Yes.
I am watching you.
Yeah.
You are talking for 1 minute, 2 minutes, 3 minutes, 5 minutes. Then you'll get fed up.
Of course.
Then you'll become angry.
True.
What happened to you? Are you deaf? The word deaf you said, but I am not able to hear that deaf word also. Because the individual is deaf.
True. That's a really encroachment into your day-to-day activities.
Exactly.
In a way.
Exactly. Deafness will separate the individual from the society.
My God.
Yeah. He is in the society, but he can't hear the sounds, he can't hear the conversation, what's happening in front of him. So that is the most disadvantage of a person with deafness. So deafness means inability to hear. There is no reception in the body.
So doctor, what is the onset of this hair loss or this deafness? Is it gradual or is it sudden?
Sudden. If you ask me, deafness can be from birth.
Okay.
What we call congenital.
Congenital.
Congenital, meaning When the child is born,
Born.
child is not able to perceive sounds.
Okay.
But at that time, child is not aware that he is not able to hear.
True.
Parents are not aware that he is not able to hear. After few months, like there are milestones when the child crawls, then walks, then speaks.
True.
So say after 6 months or say 8 months, when they say amma, nana, they are not able to produce sound. Then parents will come to us and tell, like, my child is not speaking.
Okay.
So we screen them. We screen them through some test. Then in the test, we come to a diagnosis: the child is not able to hear. We coin them as deaf child.
So you mean to say that when there is no reception,
Yes.
there is also difficulty in the speech?
Yes. Dumb. They become dumb.
Dumb.
Then you term deaf and dumb.
Dumb.
Deafness, they are not able to speak. So deaf and dumb.
Okay.
Okay. So that's in the congenital, meaning when the child is born. Second, injury to head.
Okay.
Injury to head will lead to the damage to the inner ear. So if you permit me, I'll explain you what
Please.
is inner ear.
Please.
So if you see it here, this is our outer ear, pinna. The sounds that travel, this is our membrane,
Eardrum.
eardrum, correct. Then we have bones, tiny bones behind the drum.
Okay.
So this is called second part of the ear.
Okay.
This is first part,
Okay.
second part, and you are seeing a coil here.
Uh-huh.
That is the third ear, inner ear we call.
Okay.
This is the main organ where the nerve starts and goes to the brain.
Okay. So you mean to say that is the transporter or the stimulator for these waves to reach brain waves?
Receiver, then processor, then sending the sounds to the brain.
Okay.
If this is damaged, we can't hear anything.
Oh my God.
Though this is normal, third ear is not functioning, we can't hear. So you asked me why we can't hear, right? Meaning the inner ear is not working. So I said when this is damaged, we can't hear.
Okay.
So I said congenital from birth, second is accident, third is infections. Infections can be, in general term, from mother to child, like maternal infections.
Oh my God.
Through mother to child. There are certain viruses which are transmitted from mother to child.
While being in the womb.
While being in the womb.
Okay.
Yes. So again, it comes through virus. So since birth, child is not hearing.
So you mean to say there are certain viruses which affect this inner ear
Yes, yes.
and which are transmitted through mother
Yes.
while being in the womb itself?
Yes, yes.
Oh, okay.
Okay. And number 4, there are certain drugs which damage the inner ear.
So hence no medication while
During pregnancy and during childhood, or when you are having certain infections like tuberculosis.
Oh,
Tuberculosis, we give certain injections like streptomycin.
okay.
It's an injection.
Uh-huh.
The moment streptomycin is given, we give a caution before giving injection to the individual that this may lead to hearing loss.
Okay. I keep hearing while being pregnant, you can't have things like cough syrups,
Yes.
any peppermint or anything that reduces your cough.
Yeah.
So do you think even that is related to this kind of drugs?
Not particularly hearing, but it has harm. It is harmful to the child in the womb.
Okay.
Yeah, yeah.
Okay.
Yeah.
This is a very deep subject.
Depth. Yes.
While the parts that are, developing within the body while they were in the womb.
Exactly.
So deaf and dumb basically from the start, from the inception starts through the mother.
And during childhood, as I said, accidents, injury to inner ear, and as we grow, say, we call senile deafness. Senile
Okay.
deafness, which happens after 60 years, 65 years, wherein naturally the inner ear starts shrinking, deteriorating.
Okay.
Say for example, you have 100 cells in the nerve. As individual grows, the number of cell population starts declining.
Okay.
So he cannot perceive the sounds. Suppose I am talking to you, he may perceive with my lip reading.
Okay.
If I go to his side and talk to him, he may respond, but there is no clarity of the sounds.
So it is just like the internet. Today we have those, what do we say, broadband connections, the receivers, all the satellites. It is just like that, taking in the waves, converting them.
Yeah.
So you grow older, they shrink, and the parts might not respond the same way that they used to.
Yes, degeneration.
So that's gradual.
Yes.
Okay. So usually it is a gradual process. This is what I understand, because the deaf and dumb that we're talking about from the womb.
Yes.
So that's also a gradual process.
That's a gradual process, but people are not aware the child is deaf and dumb. Only after certain months
they'll realize.
Yes. Now for that latest to diagnose whether child is normal or not, there are intranatal investigations. Number 2, immediately after birth, there are certain investigations wherein you can catch whether the child is normal or not hearing.
Okay.
So we can diagnose at an early phase, then we can give proper treatment.
That is wonderful, sir. I mean, very eye-opening for me itself, because being a mother,
yes,
even I understand, that those little intricacies that we need to take, the care, that need that we need to take while we are pregnant.
Yes.
It is very, very important, I feel.
Yeah. During pregnancy, hardly we give any drugs to patients.
Patients, true.
Yeah, hardly give. Unless it is dire emergency of giving antibiotics to certain infections. Yeah.
Thank you so much for this session, sir.
Yeah.
Thank you so much, because you enlightened us with a lot of little facts that we really never knew about. Thank you so much for this wonderful session, sir.
Most welcome. Yeah. Thanks for giving me this opportunity.